Hi, everyone. My name is Lauren Cloward, and I'm with the Western Governors Association. Thank you so much for joining us today for our webinar on disability inclusive policy and COVID-19 economic recovery. Nadia Mossburg, Senior Policy Advisor with the U.S. Department of Labor's Office of Disability Employment Policy, will start us off with some opening remarks, followed by a presentation and moderated discussion with our state speakers, led by Bobby Silverstein. Thanks so much for joining us today. And Nadia, go ahead and take it away.
Thanks so much, Lauren. And hello, everyone. I want to thank you all so much for being here today and for allowing me to share a few brief remarks to kick off this exciting webinar. As you heard, I was Senior Policy Advisor in the ODEP, or the Office of Disability Employment Policy. We're a small, non-regulatory agency within the U.S. Department of Labor that works to increase workplace success for people with disabilities. We do that through a wide range of policy work and by collaborating with employers at all levels of government. When people think about it, they correctly assume that much of our work is at the federal level. But that's what's so exciting, is how we've been able to extend our policy reach by leveraging partnerships, interagency coordination, and hands-on work with state and local governments and policymakers. The latter, of course, has primarily been through our State Exchange on Employment and Disability, or SEED. SEED is a unique federal-state collaboration that helps states and local localities implement policies that advance the employment of people with disabilities and strengthen their own economies in the process. Put simply, SEED acts as an educator and hands-on policy guide. We offer background on disability employment-related policy practices, show you where inclusion intersects with your own policy agenda, and if needed, help you shape your own effective policies and put them into practice. Our approach is rooted in the sharing and adoption of best practices, because we know that every state has unique challenges and opportunities. SEED believes that many strategies and policy actions can be successfully replicated by others. We're immensely proud of SEED and the important work it continues to accomplish, working with intermediate organizations like Western Governors Association, the National Governors Association, and the Council of State Governments, the National Association of State Legislators, and the U.S. Conference of Mayors, and others. SEED has been instrumental in helping states and local stakeholders implement crucial policies that advance the employment of people with disabilities. In ODEP, our primary focus right now is to ensure a disability-inclusive COVID response and recovery. And that is so incredibly important when you consider that people with disabilities are more likely to have become unemployed due to the pandemic, and that the rate of recovery for people with disabilities is slower. As the economy recovers and individuals return to the workplace, the design and implementation of inclusive workforce policies help us not only rebuild, but rebuild stronger than before. As you policymakers continue to steer your pandemic responses at the state and local levels, it is especially important to ensure that your new policies aligned with disability and civil rights laws. It's all part of the pursuit of full inclusion in an American workforce that accurately reflects the diversity and skill of all its citizens, including those with disabilities. But it's also smart business sense, because in a recovering job market that is facing key labor shortages, people with disabilities can help fill the gaps and be part of the job solution. So, advancing the employment of people with disabilities is an obvious and fruitful way to bolster your economies and build strong workplace cultures that embrace diversity, equity, and inclusion. When the pandemic hit, we started analyzing its impact on people with disabilities and anticipating how the recovery would affect their employment. And in response, SEED launched an effort that many of your states were part of, the COVID-19 Collaborative for an Inclusive Recovery. The collaborative focused on 3 topic areas. First, inclusive safety and health policies, including telework. Second, inclusive vaccinations and mental health policies. And third, inclusive workforce readiness policies. And based on the insights, policies, and promising practices gleaned, SEED distilled the collaborative's work into a policy checklist and a guide called Frameworks for a Disability Inclusive Recovery. I believe one of my colleagues is posting links to these resources in the chat window. I'm so pleased that today we're going to be exploring some of the strategies outlined in that guide, specific ways to empower all workers by adopting disability inclusive COVID-19 recovery policies and initiatives. Before I conclude, I have to mention that it's our favorite time of year in ODEP, National Disability Employment Awareness Month, or NDEAM. Held every October, NDEAM is a fitting time to educate about disability employment issues and celebrate the many varied contributions of America's workers with disabilities. The 2021 NDEAM theme is America's Recovery, powered by inclusion, which dovetails perfectly with the issues we'll be discussing today. It's a theme that reflects the importance of ensuring that people with disabilities have full access to employment and community involvement during the nation's recovery from the COVID-19 pandemic. NDEAM is led by ODEP at the national level, but its true spirit lies in the many observances held at the grassroots level across the nation every year. In fact, many governors issue their own state-focused NDEAM proclamations each year, and we also encourage you to take part and celebrate. For ideas on supporting NDEAM, you can visit www.dol.gov/NDEAM, NDEAM. Ways you can celebrate range from highlighting disability inclusive efforts in your state throughout the month via social media to issuing a state as a model employer executive order. One of my team members will post another link in the chat that includes more details on how you can celebrate. And that said, however you choose to take part, you'll be playing an important role in fostering a more inclusive workforce, one where every person is recognized for his or her abilities every day of every month. And with that, thank you for the discussion, and I'll pass it off to my colleague, Bobby Silverstein.
Thanks so much, Nadia. Next slide, please. Again, my name is Bobby Silverstein. I will be the moderator for the panel. And before we jump in and I introduce the panelists, I'm going to give you a quick overview of some of the major findings from the COVID-19 Policy Collaborative and describe some of the key policy options that that your colleagues around the country have adopted and you may want to think about doing yourself. But to provide a context for this discussion, let me give you first a little background in terms of my bio. I was the former staff director and chief counsel to the U.S. Senate Subcommittee on Disability Policy, where we worked on 20 different pieces of disability-related legislation, including the landmark Americans with Disabilities Act. After I left Capitol Hill, I formed a disability policy center, and for the last 12 or 13 years, I've been a principal in a Washington, D.C. based law firm called Pyles Sutter Verville. Currently, I am the policy and legislative counsel for the SEED project. Let's look first at some of the policy resources that we have for you that we've developed. And all of these resources focus on the phrase disability inclusive. And let's define that phrase before we jump in and describe some of these various resources. What we mean by disability inclusive is that the disability perspective is reflected in the policy, in the plans, in the practices that are developed by the state. And these policies or practices to be disability inclusive must be aligned with our nation's civil rights statutes and be consistent with them, including the ADA and state non-discrimination laws. Now, one could say, we have a pandemic. We have to worry about keeping everybody healthy and safe. We can't worry about balancing that priority with equal opportunity. Well, the EEOC, the Equal Employment Opportunity Commission, the OSHA, Occupational Safe and Healthy Administration in the Department of Labor, and the Centers for Disease Control and Prevention, CDC, have all worked together. So there's no question of balancing. It's a question of taking into consideration the civil rights issues at the initial design stages so that the ultimate policy or plan reflects the needs of, among others, people with different functional needs, in this case, people with disabilities. We call this universal design. And so the overarching takeaway is, if you design your COVID-19 pandemic policies to be fully universal, they will be disability inclusive. And one does not have to compromise health and safety in order to make sure that they meet the needs of all, including people with disabilities. So as Nadia said, the key outcome resource from the collaborative were these frameworks. And I will be spending a little bit more time discussing some of the key findings and policy options. But in addition, the SEED project every month updates another document, which includes all of the federal policy guidance that has been issued by all of the federal agencies that relates to COVID, that relates to employment, and has a disability perspective. And literally every month we update this document, and you can find on the Council of State Governments website the updated version. And NCSL has information as well. And at the DOL ODEP website, we have information also. Next slide, please. So what are some of the key issues that the collaborative addressed? The first is health and safety policies and plans. We'll hear from Elizabeth a little later about what Governor Inslee did in Washington as an example in terms of executive orders. But when a state develops its policies or plans for returning to the workforce that they develop for the state agencies, or they develop templates for the private sector, it's important that these policies and these plans are disability inclusive. What does that mean? It means including references to the Americans with Disabilities Act. It includes specific examples of how these plans will be implemented with respect to confidentiality, disclosure, masks wearing mandates, vaccinations. How do you make sure that these issues, the nuances of the policies and plans, are reflective of people with disabilities? And one overarching issue is a recognition of the need to make reasonable accommodations, modifications of policies, practices, and procedures. Another key issue that we addressed is telework. A typical policy that we've reviewed, and we reviewed all 50 state policies, will start with the sentence, telework is at the sole discretion of the manager or supervisor. Well, in fact, that is a misleading statement, and it's not a disability inclusive statement, because if an individual with a disability needs a reasonable accommodation in the form of telework, it is required unless it will result in a fundamental alteration in the program or the modifying essential functions of the job, or unless it would result in an undue hardship. So telework is in fact not at the sole discretion of the supervisor or manager when it comes to people with disabilities. So in our documents, we have a number of policy options for making sure that telework is in fact disability inclusive. There's also questions in terms of vaccinations. We're not talking about whether they should be mandatory or not. That's another issue. That's for the states. That's a whole different issue. The question is, if they are mandatory, what are some of the disability inclusive policies that must be addressed? Some people with disabilities may not be able to be vaccinated. What are the policies that you can adopt to ensure the health and safety of the individual and other coworkers, and at the same time ensure that there is an opportunity to work? It may be mask, it may be more social distancing, but all of these issues can be reviewed with a certain framework to ensure that health and safety occurs in the workplace and that people with disabilities are still provided an effective and meaningful opportunity to work. And there are also broader policy issues for the governor. In Massachusetts last week, there was a settlement that dealt with accessibility of vaccination sites and the website dealing with vaccinations. So it was registration for state policies for registering for vaccinations, as well as the accessibility of the sites. And in some cases, transportation is provided to sites. Is the transportation accessible to people with disabilities? We also dealt with the issue of mental health, the stress that folks are feeling, both by being away from the office as well as returning to the workplace. And there are a number of policy options that we've identified that address this issue, ranging from telemental health parity to educating managers and supervisors in terms of having an open communication, dealing with issues of transition age youth who are going through all kinds of additional stressors, and frontline workers, particularly essential healthcare workers, in terms of the stress that they're feeling. We also looked at the particular issues for minority communities, racial and ethnic minority communities, in terms of the greater impact it's having. And as a third issue, we looked at what your colleagues around the country are doing in terms of workforce readiness. How do you deal with work-based learning experiences, apprenticeships, when in a virtual world? How are you dealing when you're going back now to see folks online? The accessibility of your virtual sites, another big deal. Use of assistive technology devices and services in terms of the American Job Training, the vocational rehabilitation programs, the educational systems. So that's a kind of brief, quick overview of the frameworks. And again, if you're looking for, oh, this is interesting, we have a comprehensive framework. We have a short version that only includes the policy options, and we include a checklist so that you can pick and choose of things that are of particular interest to you. Now I'd like to move to our panel. I'm going to ask each of the panelists to introduce themselves. Nadia has already said hello. Elizabeth, Chanda, and Susan. Why don't we start with Elizabeth? Why don't you give us a quick introduction?
Hi, everybody. I'm Elizabeth Gordon. I am the Executive Director of the Governor's Committee for Disability Issues and Employment in Washington State. We are an independent committee of 27 gubernatorially appointed members who try to make sure that the voice of people with disabilities is represented in policy and government. Very happy to be here today.
Thank you very much. Chanda, why don't you go next?
Sure, thanks. Hi, my name's Chanda Hermanson. I'm the Administrator for Disability Employment and Transitions at the Department of Public Health and Human Services in Montana. We have the Vocational Rehabilitation Program, our blind and low vision programs, deaf programs, independent living services, the relay system, that type of thing to help people with independence and employment.
Great, thanks. Susan?
Hi, good to be here. I'm Susan Weidenbach. I am the statewide manager for workforce development and special projects with the Kansas Department of Commerce. We, of course, are the economic development agency for the state and also the workforce development agency for the state. I supervise folks ranging from disability employment coordinator to employment network to benefits counseling, all the way across the gambit, and serve as staff for our Employment First Oversight Commission, our Kansas Commission on Disability Concerns, and our Transition Transformers Coalition for improving transition from public school to adulthood. Thank you so much for having me. Appreciate being here today.
Great. Let's jump right in and start with Elizabeth, but folks, chime in whenever you would have something to share with us. Elizabeth, tell us a little bit more about what Governor Inslee did in terms of dealing with high-risk employees and workers' rights, and how disability was part of that effort.
Absolutely. Well, early on in the pandemic, Governor Inslee issued Executive Order 20-46, which dealt specifically with high-risk employees, workers' rights. And the purpose of that particular piece of legislation was it applied to both public and private employers, was to set the standard that employers needed to be able to provide some job protection for people, and that if people were trying to exercise their rights and their needs for reasonable accommodations around the pandemic, that their jobs should be protected and their benefits should remain intact. And then most recently, Washington State Legislature has codified that into the Health Emergency Labor Standards Act, which creates policy under the Department of Labor and Industries in Washington State and ensures that these protections continue on. Essentially, this particular act establishes workers' rights during a time of public emergency, public health emergency. It establishes that employers need to be able to look at accommodations and figure out how to make sure that people can retain their employment. So it protects workers from being discharged, replaced, or being retaliated against for seeking accommodations when they're trying to protect themselves from an infectious disease. And it establishes who a high-risk employee is as people who might have an underlying health disability or other things that might make them either more likely to get severely ill because of an exposure to an infectious disease, and in this case, COVID-19, or who may have an underlying health condition that makes it so that they're not able to get vaccinated and get connected to that. And so it really requires employers to look at alternative work environments for people. It sets the standard that employers can look at telework as a reasonable accommodation. Of course, we know that under the Americans with Disabilities Act, but it really sends the message from the state leadership level that inclusion and accommodation are expected during this state of emergency. And that has really been an incredible support for people with disabilities in Washington State. And having this now move into where it's part of our permanent code sets that standard rolling forward for any other potentially infectious disease situations that may come along. The other piece that is an interesting part of the healthcare, the Health Emergency Labor Standards Act is that it establishes that one of the reasons that a person might be protected is that they wouldn't be able to be present in the workplace. And so if that person is considered high risk because they can't be a part of the workplace, they would fall under this particular act. And it requires an employer to provide accommodations and go through that reasonable accommodation process. I also think another thing that has been really incredible in Washington State is that because early on this precedence was set, one of the things that was created out of our state human resources department was the Healthy Washington Roadmap to Reopening, which is now in its 13th revision because, of course, the landscape of the pandemic changes. But it walks through and helps state agencies go through a decision-making tree around when to reopen, what reopening might look like, what factors to take into account. And then as an adjunct to that, we had a reasonable accommodation roundtable that we hold quarterly in the state of Washington for human resources practitioners who work with our employees around reasonable accommodation. It's a place for people to meet their peers who are doing that work across the state, and also a place to just have a centralized conversation. And we had a conversation back in September. We were anticipating at that point that most of our state agencies would be reopened. And of course, the landscape of the pandemic keeps changing. And we were actually pretty nervous setting that up because things were changing so rapidly. But it was a place for us to have a conversation and talk about reasonable accommodation, update our human resources practitioners on some of the guidance that's coming out of the EEOC on long COVID and its establishment as a disability under the Americans with Disabilities Act, and have a coordinated conversation around what things we're looking at that point in time. So I'll pause there so there's time for others to share.
Great. And quickly, Nadia, we know that the Department of Labor and a lot of other number of other federal agencies are developing similar return to the workplace plans. And Department of Labor, it seems like every 2 or 3 weeks, updates its plan like you were describing, Elizabeth. And that plan, if you all are looking for a template, is incredibly disability inclusive. They have a number of issues and they give examples, reasonable accommodations, how to deal with confidentiality, personal protective equipment, face masks, possibly that are clear if you have deaf employees who do you want to share a little bit about that process of ODEP's role and why is Department of Labor taking such an initiative and showing such leadership?
ODEP played a critical role in the development of the strategy, but leadership from the Occupational Safety and Health Administration was also part of the Seed COVID-19 Collaborative, which I think helped inform DOL's response and return to work strategy. So thank you very much, Bobby, for bringing that up.
Great. Chanda, do you want to share a little bit about how your state is using some of the CARES Act and ARPA funding to help make sure that state policy is disability inclusive?
Absolutely. So when the state had the opportunity to pull down the CARES Act and American Rescue Plan Act, the first thing we did was did deep dive and analysis of how can we use these resources to benefit people with disabilities in the workplace. So our first initiatives during the CARES Act funding was we did buy a lot of clear face masks, as were just mentioned, and it was a really good tool to inform the state, the entire state department of what clear face masks can do, not only for people with disabilities, but maybe the children we're serving or the elderly we're serving. So it was a really good way to start some conversations on just universal design around customer service. So that was a great opportunity. We also took that opportunity to develop a program in which we funded assistive technology for people with disabilities that were transitioning from their traditional work location to telework, to ease the burden of that expense for businesses so they wouldn't have to duplicate purchasing, and to ensure that that transition could happen rapidly as it did for everybody else, get the equipment in place, and to make sure that the job would be impacted as little as possible, and that employment opportunity could be maintained. So that's what we did with the CARES Act. So when the American Rescue Plan Act came out, individuals with disabilities are specifically prioritized as underserved and underrepresented groups in the current labor force in ARPA. I'll just call it ARPA moving forward. So again, we got to take an opportunity of how can we leverage these funds to have a meaningful impact on not only people with disabilities, but the workforce across Montana, because that, as we're all experiencing, is having significant deficits, and people with disabilities is some part of the solution to this. So how can we creatively look at things and use our resources wisely? So what we did with that is we looked at our vocational rehabilitation program. The VR program in Montana is currently under what's called an order of selection, meaning there's not enough funds or staff available to serve everybody that is ready, willing, and able with a disability in Montana to go to work that needs those services. There's currently about 1,000 people on that waiting list while we're facing workforce shortages. So what we're going to do is access $2 million of the ARPA funds to augment the current staffing levels in that program so we can pull those people off of the waiting list at a quicker pace and get them the services and training they need to enter the workforce. Because again, they're ready, willing, and able. They're already eligible. They're waiting. So we're going to really use this opportunity to clear that list and get people to work that want to go to work. Additionally, the Workforce Commission has passed employment and training grants for businesses that support opportunities for people with all kinds of different barriers to employment to get into the workplace and really start meeting some needs. We're working with the Department of Commerce on that right now. So people that hire and train people with disabilities will have the opportunity to access a $500 bonus. So that will be a partnership between our Department of Commerce and the Vocational Rehabilitation Program. And we're really looking at replicating our disability employment preference system we already have in place to allow for certification to access these funds. So that's in the works, but exciting and a great opportunity to really utilize the resources that we've never had available before and get some great work done to meet various needs across the state.
Great, thank you. And Susan, I'd like to ask you to jump in here in terms of some of the workforce readiness initiatives that your state is also is focusing on, but you're a leader in terms of some issues, employment first, benefit counseling. Why don't you share some of what your state is doing and the impact that COVID's had and how you have kind of adjusted some of your initiatives to address the virtual as well as the in-person. You're still on mute, Susan.
Golly, sorry. Thank you very much. Kansas was the first state to enact an employment first law in 2011. It was amended in 2013 and created an employment first oversight commission, which are 7 folks appointed by the governor and each side of the house of the legislature. And then many of us from state agencies staff that process. And it is the Employment First Oversight Commission is the framework by which we advocate for and advocate with issues with people with disabilities across the state, not only in state government and local government, but in the private sector. So we have kind of consolidated at the policy level most of the discussions and action at that level, so that we have access to the policymakers and hopefully then more influence over the policymakers about what we're able to do in Kansas. You mentioned benefits counseling. What we've done in Kansas is our workforce system is a statewide employment network, and we use the revenue from the employment network to hire and train benefits specialists. So not only is our Medicaid program at the State Department of Health and Environment, they employ 5 benefit specialists. Kansas lost its WIPA that is now done through the state of Nebraska. But we have been able to add additional benefit specialists through our employment network and are now looking to subcontract or subgrant those funds to our local workforce development boards so that they can also have staff who provide those benefits counseling services.
Why is benefit counseling so important in terms of employment?
It's so important because people who receive Social Security benefits believe that if they go to work, they will lose their benefits.
Right.
Kansas is one of the only states that we have a working healthy program that allows a waiver so that you can earn over $60,000 per year and still not lose your benefits for your medical coverage, et cetera. It is a program that helps an individual become independent to the highest extent possible. So we've done close work with our Department of Environment, our Department for Children and Families, which is our HHS department, which houses VR and other disability services. So all of us work together through the Employment First Commission, through the Kansas Council on Disabilities and other subgroups to try to draw a line through all of the policies and programs available in the state.
Susan, could you, maybe you're going to jump into that next, give folks a little sense of the underlying purpose and function and policy of Employment First?
Sure. Employment First establishes, as I said, the Employment First Oversight Commission. It is basically designed to increase the number of people with disabilities who are employed competitively and at least minimum wage. We are taking, for example, part of our CARES Act funds, part of our COVID resources, toward building a pilot that will establish a business model for providers to be paid at a higher rate to provide employment services such as job coaching, on-site services, rather than sheltered workshops or other congregate settings. We have, as far as we're concerned, a large number of organizations that still have the certificate that allows them to pay a sub-minimum wage. Those of us who advocate for folks obviously would like to have 0 of those organizations, but we can't argue that until we're able to just demonstrate a business model that will allow our local providers to be able to survive, even though they're providing a different kind of service. So for those of us who serve as advocates across the state governments, local governments, and communities, are really excited about the possibility of being able to demonstrate a model that will allow someone to work competitively and to be independent to the best of their ability.
Mhm.
So,
Go ahead.
yeah, well, that kind of sums up employment first, is to increase the number of folks who are employed.
So can you talk to us a little bit about the interagency work that includes the Department of Education and local school systems, and how IEPs have been adjusted over time to make sure that the outcomes are competitive integrated employment?
Sure. So the Employment First Oversight Commission for almost 10 years has looked at, studied not only national studies, but also we have commissioned studies of not only what people believe they are eligible for and believe what they receive, but also what do they think the individuals, their parents, their guardians, their advocates, their family members, what else do they need in order to be as successful as possible? From that, time after time comes, gee, I didn't know until my child was a senior in high school that we needed to work toward transition, for example. Through those studies and conversations about that, our State Board of Education chair brought together a work group of us to look at actual policy. What can we do in the public school system that will encourage employment preparation, the reality of employment possibilities for our students in the state? After a 3-year process, we developed actual policy that requires local school boards to change or modify the way that they do IEPs and 504 plans to make sure that employment is the first outcome that a child will be directed toward, whether that's through first going to post-secondary education and training for certification and education, or whether that's leaving high school and going directly into a job. We have just implemented this year. In fact, will be the first time it's implemented statewide. We had some pilot school districts that have done it over the last couple of years. So it'll be interesting. We'll be doing studies over the next few years to see whether or not that's working. Has that made a difference? We are looking at a culture shift. Why is it that parents don't believe that their second grader is going to grow up and be able to take care of themselves? We need to address that before they're senior in high school or 28 years old, or after things happen in the family that no one is left to take care of them, and they've never believed that they are able to take care of themselves. So that is our number one priority, is to change that culture.
Mm-hmm. One last quick question before we sum up and give everybody an opportunity to share some last thoughts. COVID, work-based learning experiences was a big part of what you did, and whether it's education, VR, or American Job Centers. We know from the literature that if a employer, a supervisor, manager sees, experiences, works with a person with a disability, that's the best way to break down stereotypes and actually hire folks. How did you deal with that in terms of the pandemic and the virtual world?
So both our registered apprenticeship programs are project search programs. For folks who are familiar with project search, is a work-based learning program for folks in secondary school. And our on-the-job training programs all remained active during COVID. We are able to use our WIOA Title I funds for supportive services to help someone purchase anything that they need to be able to work, whether it's PPE, whether it is transportation to get their vaccination, whether it is masks and anything else that is needed at the workplace. Obviously, we did everything we could to facilitate the social distancing or whatever else may be required based on the governor's executive orders and mandates for COVID response, while our generalized community-based on-the-job training, much like our post-secondary education programs in person, suffered for a while because we could not get together. Most of our businesses stayed open, and most of our businesses accommodated people who needed protections so that we could continue to provide services.
Great.
So
I'm sorry, Susan.
it's, I think that I am surprised at how much continued and how safety protocols were actually effective, especially with the vaccine accommodations that were made to people with disabilities and other special populations to make sure if they wanted that they were able to be vaccinated. So I would say that we were successful in Kansas to be able to continue.
Right. Now I'm going to ask Chanda and Elizabeth to either chime in here or take time to share some final thoughts, takeaways for folks. And then Susan, I'll give you another last chance. And then Nadia, you started us off if you want to end with some of your takeaways. So Elizabeth, Chanda. Elizabeth, you want to jump in?
Thank you. Just a couple of final thoughts. The first thing is I wanted to go back with what Nadia was sharing at the beginning about this being National Disability Employment Awareness Month. One of the things we're doing in Washington State is we're taking a look at our policy that is the state as a model employer policy, Executive Order 1302. It's improving employment opportunities and outcomes for people with disabilities in state government. We are unpacking that a bit right now to see whether or not we can strengthen that and make sure that everything in there is relevant to the way we're doing business right now. And we're just in the process right now of looking to see if there are additional things we can add to that to strengthen our ability to become a model employer in the state of Washington. During this pandemic time, we've been very thankful for Governor Inslee's forethought in including people with disabilities. Governor Inslee stood up the Office of Equity this last year with the intention of making Washington State a place where we will lead with equity, and disability voice is definitely included at the table there with some goals around universal design. And so I'm sure there'll be more to come in the months ahead. But this has been a great discussion, and I really thank you for having us.
Great. Chanda?
Yeah, I think if you're not familiar with your state vocational rehabilitation agency, I would encourage you to connect with them and learn what's going on there. If they're in an order selection, what kind of things they're doing to meet the needs of people with disabilities during the pandemic. Voc rehab counselors are often really creative and already naturally. And so if your workforce services partners or adult education partners are struggling, if you're not already connected to VR, know what's going on there, I would encourage that connection be made. And again, with all of the resources that are trickling down and all the opportunities that are happening, it's a fantastic time to get creative and innovative with what you're doing. It's a great opportunity to start thinking about the world of work differently. We're being forced to, and it's just a good time to rethink it all. And again, I'm going to bring up National Disability Employment Awareness Month too, because if you're not having these conversations, it's a great time to start. So leverage the month, take advantage of it, and you could advance these conversations. Thank you.
Thank you, Chanda. And Susan, did you have any additional thoughts before we go over to Nadia?
I can't leave Bobby without talking about integrated resource teams per section 188 of WIOA. Anyone can go to doleta.gov/disability and see the implementation guide for section 188, which tells workforce services how to accommodate folks with disabilities and what the requirements are. Integrated resource team is, in a nutshell, all of the individuals providing services to an individual to come together and do collaborative case management. We in Kansas took it a step further and have created the concept of a hub of the IRT. The individual participant chooses the individual person or entity that will act as the hub of his or her IRT. So all communication and contact goes through that individual. We've instituted that statewide with our local and regional plans now, and look forward to measuring the increased success of that particular service delivery strategy. And I appreciate the opportunity. Thanks very much.
Thanks, Susan. Nadia?
Thank you, Bobby. Just want to thank everyone for their time and the discussion today. It's been enlightening, and we just really appreciate your taking the time to join us. I do want to just take this opportunity to encourage all who are listening that, as others have mentioned previously, this is really an opportunity as we move forward in recovery to recover into inclusion, and think about ways that we can increase inclusion and improve access for all people, including those with disabilities. And as we know, many people with disabilities fall into other racial and ethnic categories. So I think it's just important that we keep an open mind and look for ways to increase access. Thank you so much. And if anyone is interested in more support, the C team is here to help. So thank you so much.
Great. I think this was incredibly interesting and valuable discussion. For me, my takeaways are leadership. Governors can make a difference by sending a message. Universal design. If we take into consideration the needs of the greatest number of folks with different functional needs at the initial stages, we're going to develop policies that truly meet the needs of all. I heard the notion of people with disabilities at the table when the policies are being designed. And the notion that if we have plans, or if we have new policies, let's make them disability inclusive. So Lauren, send it back to you. Thanks for the opportunity to share some of our thoughts.
Great. Thank you so much, Bobby. And thank you so much to our panelists today, Chanda, Elizabeth, Susan, Nadia. Really appreciate it. What a great discussion. And thanks to the SEED team as well for helping us put this on. So we really appreciate it. And this webinar will be posted on our website at westgov.org and YouTube as well. So keep an eye out for that and have a great day.
Take care, everyone. Bye-bye.